بسم الله الرحمن الرحيم. طبعا انا حابب اهني كل الميليتري بورد على such elegant and prestigious and very important congress. يعني we wait for it from year to year. Thank you very much for the kind invitation. الحقيقه thank you Mr. Chairman for kind introduction. الحقيقه التيكاجريلور والكلوبيدوجريل are very important weapons we have in the last 20 years. والحقيقه انا مش عارف احنا without them how can we proceed either in the conservative plan for those patients with coronary syndromes or with invasive procedures. How can we proceed؟ كانت عمليه صعبه جدا الحقيقه. الحقيقه في study كبيره اتعملت اسمها الالفيوس ستادي، بس احنا we are going to take a deep dive inside the alpheus study as regards Ticagrelor versus Clopidogrel to reduce ischemic events after complex PCI. Our issue will be the complex PCI in chronic coronary syndrome اللي هي اتغيرت في الامريكان بقى اسمها chronic coronary disease اخر حاجه. طيب الباك جراوند بتاعنا there is a very important statements ان احنا ال PCI related MI or injuries are frequent and associated with a higher risk of ischemic outcomes and mortality. Now we have to consider in the complex PCI, yes, we have now the technicalities, now we have the tools, we have the imaging tools, we have the courage to do complex PCIs, different complex PCIs زي ما هنشوف دلوقتي الكاتيجوريز بتاعتهم. ولكن we have to keep in mind that those patients with complex PCI are at high risk of ischemic outcomes and mortality. We have some shadow of evidence about the elective PCI, the use of Ticagrelor or Prasugrel. They might be considered in specific situation in high ischemic risk with a class of recommendation 2B. It is there, despite it is a weak evidence, but it is there to use them in the patients with elective PCI with high ischemic risk. الحقيقة the multicentric randomized ALPHE trial, which is a big trial, showed no significant difference between both Ticagrelor and Clopidogrel to reduce peri-procedural MI, which we mentioned before, or myocardial injury. So they are both the same in the situation of the chronic stable coronary disease. But there is an important question raised from the ALPHE. Is Ticagrelor associated with lower peri-procedural events in the subsets of patients which underwent the complex PCI interventions? This wants a deep dive with another sub-study, another analysis from the data to look for those patients. It doesn't differ between the Clopidogrel or Ticagrelor on patients with complex PCI intervention. What's important here is to first categorize and recognize the pattern and the type of the complex PCI. والحقيقه دول كانوا recognized over 1910 patients في الالفيس trial اللي هم those patients we used atherectomy, bifurcations with 2 stents, more than 60 millimeter stent length, more than 2 stents in 1 vessel or more than 3 stents in 2 or more vessels, CTO PCI, intervention for bypassed graft, left main PCI, or there is any technical complexity during the procedure. Those are considered to be a complex PCI. So it is important to define who will be under the complex PCI. The primary objective actually is to evaluate the efficacy of Ticagrelor and the Clopidogrel as regard the MI, which are the type A or type A4B, اللي هم الستنت thrombosis. يبقى the type of the MI for those patients we will recognize is the stent thrombosis اللي هي ال MI type 4A type B. Myocardial injury at 48 hours or discharge according to the complexity of PCI. الحقيقة secondary objective to evaluate the potential interaction between the antiplatelet therapy, which is the main task, and the complexity of the PCI. Does it differ between the complexity of the there is any interaction, any impact for Ticagrelor or Clopidogrel on the complexity of the PCI, and also the MACE regarding death type of MI, stroke TIA at 48 hours, and also what is important here is the procedural complication. Coronary slow flow, no flow, dissection, and thrombus formation. If we have a look here to the results من البوبيوليشن اللي هم كانوا 910 patients اللي هم الكومبلكس بي سي اي اللي هم كانوا بيمثلوا around نص العيانين 48%، وفي منهم حوالي 14% with 2 criteria of complexity و9% with 3 criteria of complexity. If we have a look here, we can appreciate that around 36% of patients for those complex PCI with multiple stents, and come in the second rank is those patients with a total stent length more than 60 millimeter, and the other criteria, as we said, the left main, the cabbage patients, etc. The results is the primary endpoint. If we have a look here to the primary endpoint, there is no significant interaction between PCI complexity, as we mentioned from the complexities, and the criteria of the complexities, and the antiplatelet therapy for those chronic patients undergo complex PCI intervention. But we have also to consider a very important point, that high rate of primary endpoints in the complex PCI are significantly higher. And also they have higher rate of angiographic complication we mentioned, like slow flow, no flow, dissections, or thrombosis in those patients with complex PCI. So we have to recognize two main options in the results. That the primary endpoints, the angiographic complication, yes, and sure, they are much more in those patients with complex PCI. But with a deep dive in the ALPHE, there is no significant as regard the interaction between the antiplatelet therapy type, either ticagrelor or clopidogrel, and the pattern of the complexity of the PCI. It is logic here to say that the primary endpoints, according to the lesion complexity, increases, of course, from those with low PCI complexity, with one criteria only, shifting to the moderate complexity or intermediate complexity with 2 criteria of complexity, and of course it will be much more higher, up to 60% for those with higher PCI complexity, more than 3 criterion from those we mentioned before. The secondary endpoints, again, no significant efficacy of the antiplatelet therapy on the occurrence of the primary endpoints, whatever the number of the complexity criteria. Yet another confirmation about the interaction between the type of the antiplatelet and the number of complexity of the PCI, the higher rate of missing complex PCI without significant impact on the antiplatelet therapy. So that's why we will come to this very important 4 points of complication from this deep dive in the ALPHE study as regard the complex PCI. Higher rates of pre-procedural and ischemic events in stable chronic PCI patient with complex PCI will be there, and it is logic, and it is also analyzed. Stepwise increase in the risk of pre-procedural complication in case of combination of several criteria of complex PCI is also there. And what is important here from this sub-analysis is that there is no significant reduction of the pre-procedural MI and the complication by ticagrelor in comparison with clopidogrel across the different types and degrees, even low, intermediate, or high complex PCI. And finally, in stable coronary patients, outcome may be related more to the complexity of the procedure itself than the potency of the platelet inhibition, which we should be considered in our intervention procedure. And thank you for your attention.
شكرا دكتور سيد. هو احنا كل يوم والتاني يعني شغالين لنا يعني موضوع الكلوبيدوجرول، واضح انه الكلوبيدوجرول ده اوكي، يعني هو في دي اسكاليشن اوكي، وانه من غير اسبرين اوكي،
والالكتيف از فيري اوكي،
والالكتيف از اوكي. فهو كان في كلام قديم لا 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 لا، بس هو الفكره الحقيقه بتتراجع. هي انت ما عندكش غير بلاتو الاولانيه اللي قلبت المواضيع، وبلاتو بي سي اي بتاع التيكاجريلور، وبعدين تيكاجريلور لك بقى بليدنج، طب نعمل له نشيل منه الاسبرين، طب اوكي خش على التويلايت دي، طب اديله تيكو، طب يعني قصدي ايه، الاول بيشتغلوا التيكا على ان هي الهاي اسكيميك ريسك which is proof طب فعلا، بس مشكلته بليدنج. انت هنا بتحاول ترجع العرش للكلوبيدوجرول بترايلز كتيره بحيث ان انت تشوف ان هو لا هينفع. انت شايف ايه براكتس؟
وانا شايف حاجه مهمه هنا.
انا عايز اقول لك حاجه، انا عندي عيان لسه عامله امبارح مثلا،
اوكي،
انا عندي مركب بقى بلافكس بقى له سنين، بس حصل انستنت ريستينوزس وعليه اكيوت كروني سندروم، فانا فتحته عملت له دي سي بي، قلت له بقى خلاص ده خش خد التيكاجريلور. عايز اقول لك انه بالليل بينا جانب بكلب ملوش حل، مفيش بقى كونجيشن ولا هباب، ما سمعش كلامي، ما اعرفش بقى ما مين قال له تبينك منه ولا لا. الصبح غيرت، النهارده الصبح وانا هنا اهو غيرت النهجان روح.
هو كلام حضرتك صح
مش
تمام.
عارف يعني، مش فاهم، انا مش فاهم يعني.
هو
برضو انتوا قول لي ان براكتس ايه قصه النهجان ده؟
هو كلام حضرتك صح 100%. ان هو حتى النيد من السب اناليسيس من الالفيس هنا كان ايه؟ ان هو عايز يقول لك ان الانتي بليتلت مش هو قصه في الكومبلكسيتي بي سي اي، مش هتفرق يعني، مش هتفرق كلوبيدوجريل ميتيجريل في الكومبلكسيتي هيبقى ليها باثواي لوحده، ان هو هاو كومبلكس ات از اند هاو ذا كومبليكيشن ويل بي، مالهاش علاقه بالانتي بليتلت دي حاجه. وعايز ياكد حاجه ثانيه مهمه جدا، ان انت لو جيت على حساب الكومبلكسيتي دي واديت تيكاجريلور وهي مش بينيفيشال يو ماي انكريز ذا ريسك اوف بليدنج without benefit. فهو عايز ياكد الحته دي، فلذلك هم عملوا السب اناليسيز من الالفيس.